Hello friends, I am going to talk about pathology of pneumonia. Pneumonia is an infection that inflames your lungs air sacs. The air sacs may fill up with fluid or pus causing symptoms such as cough, fever, chills and trouble breathing. Signs and symptoms of pneumonia. Cough, which may produce greenish color, greenish yellow or even bloody mucus. Fever, sweating and shaking chills. Shortness of breath, rapid shallow breathing, sharp or stabbing chest pain while breathing and cough, loss of appetite, low energy and fatigue, confusion especially in older people, bacterial pneumonia. It's more serious than any other type of pneumonia with symptoms that require medical care. Sudden fever, rise as high as 105 degree with profuse sweating and rapidly increased breathing and pulse rate. Lips and nail beds may have bluish color due to the lack of oxygen in the blood. A patient's mental state may be confused or delirious. Viral pneumonia. Viral pneumonia symptoms develop over a period of several days. Early symptoms are similar to influenza fever, a dry cough, headache, muscle pain and weakness. Within a day or two, the symptoms typically get worse with increasing cough, shortness of breath and muscle pain. There may be a high fever and blueness of lips. Symptoms may vary in certain populations. Newborns and infants may vomit, have a fever and cough or appear restless, sick or tired and without energy. Older adults may have fewer and milder symptoms, lower than normal temperature. Older adults have sudden changes in mental awareness. When to call a doctor? See a doctor right away if you have difficulty in breathing, develop a bluish color in your lips and fingertips, have chest pain, a high fever or a cough with mucus that is getting severely worse. It's especially important to get medical attention for pneumonia if you are above 65 years old, children of age 2 or younger, people with weak immune system. For some of this vulnerable individual, pneumonia became a life-threatening condition. Pneumonia diagnosis. Sometimes pneumonia can be difficult to diagnose because the symptoms are often very similar to cold or influenza. To diagnose pneumonia, your doctor will ask about your medical history, do a medical exam and see some tests. Try to identify germ that is causing the illnesses. Medical history. Your doctor will ask questions about your signs and symptoms and when and how they began. Any recent travel, your occupation, contact with animals, exposure to other sick people at home, work or school, whether you have recently had other illnesses. Physical exam. Your doctor will listen to your lungs with a stethoscope. If you have pneumonia, your lungs may make crackling, bubbling and rumbling sounds when you inhale. Diagnostic tests. Blood test to confirm the infection and try to identify the germ that is causing your illnesses. Chest X-ray to look for the location and extent of inflammation in your lungs. Pulse oximetry to measure the oxygen level in your blood. Pneumonia can prevent your lungs from moving enough oxygen into your bloodstream. Sputum test on a sample of mucus taken after a deep cough to look for the source of the infection. If you are considered a high risk patient regarding age and health, doctors may want additional tests including CT scan of the chest to get better view of the lungs and look for abscesses or other complications. Arterial blood gas test to measure the amount of oxygen in a blood sample taken from an artery, usually in your wrist. This is more accurate than the simpler pulse oximetry. Pleural fluid culture, which removes a small amount of fluid from around the tissues that surround the lungs to analyze and identify bacteria causing the pneumonia. Bronchoscopy, a procedure used to look into the lung airways. If you are hospitalized and your treatment is not working well, doctors may want to see whether something else is affecting your airways such as blockage. They may also take fluid samples or biopsy of lung tissue. Thank you. If you like my video, please like, subscribe and share my channel.